Thank you for joining us for this healthy living lecture on the importance of fall prevention. My name is Maggie Jackson, and I'm the manager of Medicaid and Medicare marketing here at Henry Ford Health, and I will be your moderator for today's lecture. This morning, you will hear from Stephanie Booza and Jennifer Elrod, injury prevention specialists at Henry Ford Health. The Henry Ford Health Injury Prevention Team offers a variety of resources and classes to help our patients and the community stay safe within our facilities and in their daily lives. In the next hour, Stephanie and Jennifer will teach you how to reduce your risk of falling by taking your medication safely, the importance of having your vision and hearing checked, and what to do next if you do fall. This is the first of 3 injury prevention webinars. Please visit the Healthy Living website to register for the webinars on the importance of exercise in July and home safety modifications in September. Following the presentation, we'll have a question and answer session. If you have a question during or after the presentation, please type your question into the chat box and do not share any personal medical information. Also, to ensure a smoother experience for all, please turn off your cameras. And note that your microphones have been muted. This lecture is being recorded and will be available to listen to again on the Healthy Living Lecture Series webpage at henryford.com/healthylivinglectures. Now I am happy to introduce Stephanie Booza and Jennifer Elrod.
Hi, thank you, Maggie. My name is Stephanie.
And I'm Jennifer.
And we are going to present our importance of fall prevention for you today. Our goal of our presentation today is to maintain some independence by adopting some easy ways to make your lifestyle and your home safer. Reducing falls is our top priority for you. Some fall facts. So 1 out of every 4 adults over the age of 65 fall each year. Over 3 million older people are treated in the emergency department for a fall-related injury every single year. And 85% of falls occur at the home among independent older adults. Falling once can double your chances of falling again. And 95% of hip fractures are caused by falling, usually sideways. This isn't meant to frighten you, but to get you to seriously think about changes and how to make your life safer. So some of the fall risks that we have are age-related changes. So that includes your vision. We know as we get older, our vision kind of goes a little bit worse. Our muscles get weaker as we get older, and our reflexes go down as we get older. Some environmental factors to be considered is medications, alcohol, and home hazards.
And then, are you at risk? So are you over the age of 50 and above? Are you female? Have you had a previous fall? Do you have a history of some confusion? Any debilitation? If you are on multiple medications, have a history of arthritis, postural hypotension, which is the lowering of your blood pressure as you change from a sitting to a standing position, any dizziness, visual impairment, and then cardiovascular disease. So for females, you're 3 times more likely to fall than are males, and also 3 out of 4 hip fractures occur in females as well. So true or false? Falling is a normal part of aging. And that is absolutely false. So even with the increased risk factors, falling is not a normal part of aging for you. So how can we prevent falls?
4 different things. Actually, we're going to talk about 2 different things today. And then over the course of the series, you guys will hear about exercise and home modifications later. So the first thing that we're going to discuss today is medication safety, as well as visual acuity and hearing. And I will turn it over to Jennifer to talk about medication safety.
For medication safety, one of the biggest things that you can do to help prevent medication from being a reason you fall is to know your medications, reviewing them with your doctor, sticking to a single pharmacy. With today's technology, we are very fortunate to be able to have the technology we do. However, pharmacies and healthcare systems don't always talk to one another. So if you normally fill your medications at Walmart and they're out of one of your medications, so maybe you have to go to Walgreens to have something filled, Walgreens isn't necessarily talking to Walmart. So we really encourage people to stick with a single pharmacy because of the fact that if you have a question, your pharmacist can answer many of the questions that you may have about interactions of your medications, how a medication may affect you. We encourage you never to take someone else's medication, labeling your medications accurately. So we don't like to see putting new medications in old bottles, cleaning out the medicine cabinet once a year. Sometimes as we age, our medications tend to change a little bit more frequently. We go on something, maybe it doesn't work, the physician changes us to something else, or maybe it's just as simple as a dose change. You really should get rid of those old medications and not hang on to them. The other thing is taking medications at an appropriate time. Some medications can make us more drowsy, and therefore physicians will sometimes encourage you to take a medicine in the evening to help prevent daytime drowsiness. Things like sleep aids, obviously we take at night. This weather is great for allergy season, so sometimes we need to take some antihistamines or things like Benadryl. That can make you tired as well. Anti-anxiety medications, antidepressants, there are a lot of medications that play a role in how we feel. So one of the side effects of medication is actually dizziness. Orthostatic hypotension, as Stephanie mentioned, is dizziness that is caused with position changes, such as going from sitting to standing. We always encourage, if you're taking a medication that maybe makes you dizzy, that you give yourself a few seconds and not jump up to maybe answer the door or to answer the telephone. Just give yourself a second or two to kind of collect your bearings, let your blood pressure level out, and then move. Excessive earwax can actually cause dizziness. We can experience dehydration, especially in the summertime when the weather gets hot and humid. We tend to use our reserve a little bit quicker. I know that there are many, many patients out there that tend to limit their water intake because of the fact that maybe they use the bathroom frequently and they don't want to have to use the restroom. Not getting up too quickly, limiting your alcohol intake, and it is so important to tell somebody if you are having dizziness. Sometimes something as simple as a medication change from the same class of drugs will be better tolerated by you than a medication that you're currently on. So it is important to, mention it to your physician or even a family member if you are experiencing some dizziness. So vision and hearing changes are also contributing factors to falls. When it comes to visual changes, the Today Show recently told us that by age 65, 1 in 3 Americans are going to have some form of vision impairing eye disease. Vision problems can lead to falls. Regular appointments with your ophthalmologist should be done annually. Sometimes, I know myself as I'm getting older, I tend to kind of fake it till I make it. So, when I can squint a little bit harder, or I'm noticing some subtle changes in my own vision and knew that it was time to go see the optometrist. So sometimes we have disease-related changes such as glaucoma, cataracts, macular degeneration, and retinopathy. Your age-related changes are your decrease in your visual acuity, as well as altered depth perception. We very commonly see patients falling because they missed a step, because they thought it was closer or they thought it was maybe a little bit shallower as they were stepping down. So glaucoma is some slides here, I guess, some pictures that show some visual changes of what glaucoma kind of looks like. Normal vision up on the upper left hand. Early glaucoma, that kind of vision is starting to tunnel. And as it gets worse, you're losing more and more of your visual field. Sometimes this is very slow to progress, and other times it's very quick. So with glaucoma, the high pressure inside of your eyes and poor circulation can cause damage to your optic nerve. The optic nerve is what carries images from your eye to your brain, so it tells your brain what you're seeing. And if it's not working as well, your brain isn't going to interpret it as well. In most cases, there really are no symptoms during the early stages, but as it progresses, like I said, that field of view kind of narrows and creates some blind spots. Your risk factors, if you are African American, you are at a higher risk at age 40 for some glaucoma, and age 60 for the rest of the population if you are diabetic or there is a family history. So again, visual changes can sometimes be subtle, sometimes be a little faster, but it is important to make sure that you are getting your regular eye exams. This next slide, we are talking about some cataracts. So the cataracts, if you look on the left, the normal vision photograph is fairly clear. And as that cataract progresses, it becomes more blurry. It is hard to pick out some of those sharper images. It is actually not a normal part of aging, but is very, very common. 3 out of 4 people actually have cataracts by the age of 75, and they start early sometimes. So it's actually a clouding of the lens that develops slowly. Sometimes it just can be something cloudy out there, or you just lose that little bit of sharpness. If you are seeing like glare or halos as you look out at things, that can be a sign. Poor night vision, double vision, and sometimes frequent eyeglass prescription changes. So initial treatment for some cataracts is symptom management, such as changing that prescription, brighter reading lights to help with some of that sharpness, tinted lenses for when you go outside. So I know they always want to sell me the transition lenses, so I don't have to put a pair of sunglasses on. That can be something that is simple to help. And then later treatment usually involves surgery to kind of replace that broken lens, if you will. So this next set of pictures is a descriptor of age-related macular degeneration, and it is the leading cause of vision loss in Americans 60 and older. It affects the macula, which is the part of the eye that allows you to see real fine detail. It can cause blurring of the central portion of your vision. So the picture on the right this time is what normal vision looks like. And then as that disease progresses, it gets harder and harder to where you eventually end up with like a blind spot in the middle of your vision. Risk factors for this is being over 75, female, if you are a smoker, if you have a family history, or if your cholesterol is elevated. There are 2 types of macular degeneration. The dry happens more gradually, and there is no cure for advanced dry macular degeneration. So prevention and early detection are key for that form. Wet macular degeneration actually happens rapidly and can be treated with medications and sometimes even laser surgery. So diabetic retinopathy is another disease that affects our visual acuity. It occurs when the blood vessels of the light-sensitive tissue in the eye have been damaged. Early stages often have no symptoms whatsoever, and it will eventually lead to blindness if untreated. As the condition progresses, you may experience floaters or some blurred vision, fluctuating vision, or difficulty with color perception, or a dark or empty area of vision, as seen in the photograph on the right. There's just pieces that are kind of missing from that picture. For this, prevention is the key. Having close monitoring of your blood sugar can actually slow the progression. Those that are diabetic should be getting a yearly diabetic eye exam. It is a little bit more thorough, can still be done at your optometrist's office, and is encouraged for those that are diabetic just to get that extra look. Sometimes treatments will involve laser or surgical procedures in later forms of that disease. So when it comes to hearing, hearing loss can actually increase your risk of falling. You become less aware of the environmental sounds. It can impact your balance and your gait. So once a year, you should make sure that you're having your hearing checked. And if you are told that it is time to get some hearing aids, you really need to wear them. We have plenty of family members who say, oh, you know, she just got those hearing aids and just won't wear them. She doesn't like to put them on. It is important because it is one major factor that can help prevent you from falling.
If you do fall, what happens now? What we want you to do is if you end up falling, whether it be outside, inside, in your basement, in the bathroom, at a grocery store, is just take a deep breath. Relax, look around, kind of take inventory of your situation, make sure, you know, there's not a big wet puddle on the floor, or if you knock some things over, you're not going to have any more hazards when you try to get up. So then after those deep breaths and you kind of relax for a second, check and see if you're injured. Does anything hurt? Do you notice blood anywhere? Does your hips hurt? Does your ankles hurt? Are your wrists injured? Do you feel some pain in your shoulder? After that, you take inventory. Next thing we do is we rise. So we're gonna roll onto the side that's not painful, and you're gonna get up on your hands and knees and crawl to a chair. And when we say chair, we just mean like a sturdy object. So whether that's your sink in the bathroom, the bathtub, the toilet, if you're in your living room, if you can get onto a sturdy chair, so not something with wheels, not something that's not stable for you. End tables are not our favorite things, only because sometimes they cannot be sturdy enough to hold you. And then just take a second and sit down. Take a few minutes, gather yourself, make sure, again, you're still feeling okay. And then the biggest thing is to tell somebody. So whether you have to call your doctor, you have to call the ambulance if you're injured, you call your family members, you call your friends, just let somebody know. Because if this is something that could have been easily preventable, we just don't want it to happen again. So if you do have to call for help, make sure that you're able to reach your phone. The biggest thing I can tell you, and one of our biggest takeaways that I always teach our patients, is that have some form of communication on you at all times. Pre-program your emergency numbers. So most of us have cell phones available. You're able to put in your emergency contacts. You can put in your family members. You can put in your friends just at a click of a button so you're not punching in numbers. If you do have a home phone, we just suggest that maybe you put some emergency phone numbers on your fridge. It's always good to have kind of a file of life is what they call it. You can get them from various hospitals. You can get them from the fire departments. It's just a little file that has your medications listed, any medical problems. It'll have your emergency contact phone numbers, so if there's friends or family members that people need to call, that's available and posted on your fridge. One of the things we also recommend is use a buddy system. So if you have a friend or a family member that's available to check on you every day, for example, I always give the example of my family members. So I have some aunts who are not married and they live by themselves, so they call each other every day, usually by 9 a.m. If somebody doesn't hear from somebody, they go check on them. It's just one of those things that you always have, and it doesn't even have to be a quick phone call. It could just be a text message saying good morning or good night. I've had patients tell me that they use their lights in their houses. So if they are friends with a neighbor, they flick the porch light on at night to let them know that they're going to sleep, and then they flick it off in the morning. Or your blinds. So you close your blinds at night, you open your blinds in the morning. That just signifies to your neighbor that, hey, I'm going to sleep, I'm waking up, everything's good over here. Just a buddy system is really important for somebody to be able to check on you every day. And that brings us to the end of our presentation. So if you guys have any questions, now would be the perfect time. And our contact information is up here too. So if you come up with anything in the meantime, feel free to reach out and let us know. But we will open it up for questions.
I do not see any questions, but maybe you can give us an overview of what the injury prevention program does and other services you offer.
Okay, so some of the programs that we offer, I am from Henry Ford Macomb, so in Clinton Township, and Jennifer's from here in Detroit. Programs that I offer, fall prevention, that's a huge one. We do multiple classes throughout the year. Those are actually listed on the calendar and events page of our website. And then we do what's called a Matter of Balance program. That's an 8-week-long fall prevention program. It's available nationally, so if that's ever something that you guys are interested in doing, it goes through a lot of different tactics, reduces anxiety, keeps you active, goes through all of the ins and outs of fall prevention. It's an 8-week-long class, so everything is, we become best friends after 8 weeks usually. But that's another great one that's out there. And you all, just a quick Google search, Matter of Balance classes, usually that will come up. A lot of times your local senior centers will have those too. And then I will turn it over to Jennifer.
So in Detroit, one of the biggest programs that we do in injury prevention currently is Stop the Bleed. And we do a lot of teaching as far as what to do in a bleeding emergency. But like Stephanie said, there are a lot of tools in our toolbox that we have for all sorts of injury prevention, whether it be helmet safety with bicycle use, motor vehicle safety, getting checked, how well do you fit in your car? How well do you know the technology in some of these newer vehicles? So we kind of have a lot in our toolboxes as far as injury prevention goes.
So we focus a lot on older adults because that's usually the primary population that we see at our healthcare facilities. But like Jennifer said, we do pediatrics as well. We will do driver safety. Basically, you will find us at the hospital or in the community trying to prevent injuries to keep you guys from visiting our hospital.
And if it's not something we offer, we probably know somebody who does offer or can facilitate something that maybe you're looking for.
Yes, and you guys will meet more of our colleagues in July and in September for the Future Series. So there is usually one of us at every Henry Ford hospital as long as they are a trauma center. Otherwise, we will turn it back over. Maggie, is there any other questions?
Yes, we do have a few more questions. And Meredith, I did put the link to the injury prevention landing page in the chat. So everybody feel free to check that out. So we have a question from Jenna, and that says, any steps I can take to stay safe and preventable when I'm out and about?
So for this one, some of the biggest things is, especially in the season of summer when we're talking dehydration, make sure you're well hydrated before you go out. Again, I know that not a lot of people like to drink because they don't want to have to urinate all the time. But dehydration is probably one of the biggest preventable things that you can do while out and about. Also being aware that you've got proper fitting shoes to navigate. I know a lot of construction projects happen in the springtime and into the summer. So, you may find yourself out at a business that is doing some upgrading to their cement or, just general outdoor improvements. Being aware of, the steps and paying attention to the paint on the ground. I would say in the wintertime, one of the biggest things you can do is, it sounds silly, but waddle like a penguin when you walk to avoid slipping and falling on ice. Anything else you can think of for?
Well, just to reiterate what Jennifer said, with proper footwear, we don't love flip-flops. Those are never, if you can flip in them, you can flap out of them. That's what I always say. I don't love them. Especially in the summer, they look great, they look fun, but we prefer a shoe that's a little bit more supportive for you, especially that has a backing. And if it's pouring rain outside, make sure you're wearing good shoes that you can, you're not slip sliding all over the place when you go out, so that kind of have the non-stick footwear as well. Same thing with inside of the home. We love our slippers and our cozy socks and everything, but they can also be dangerous. So just make sure you've got good footwear. I don't love the slippers that you can slip into. I do like the ones that provide, again, some backing for you. It just keeps you safer and on your feet.
Yes, we have a question from Scott. Have you seen those airbags for people that open when you fall?
I personally have not.
I have not, and typically I think that our first responders are probably going to be the ones that actually have the experience with that, meaning your EMS, your police, those that arrive once you've fallen and probably have to help pick you up off the ground.
But one of the things that is so great with technology now is that a lot of our Apple Watches will alert 911 if you do fall. So I have an Apple Watch. If something was to happen and I end up on the ground, if I don't shut that alarm off within a certain amount of time, it will call 911 for me. So that's a great tool to have in our toolbox as well.
My Google Watch also has
Perfect.
fall prevention, or has a fall detection mechanism in it as well. So it isn't just Apple products anymore. There are a lot of products out there that are offering that kind of hammock of security, I guess.
And Anthony has a question. Are you aware of community organizations, city, township, that will call senior citizens every day to make sure they're okay? For example,
So
if the person does not answer the phone, EMS will be sent.
So a couple different programs that I know personally in Macomb County. These are not daily programs per se. Meals on Wheels is a great tool, and that's available all over. If you don't answer the door, they have policies in place to make sure that your family members are contacted. They always have a second option if you don't answer the door. And I know in Macomb County, they do what's called a friendly callers program. However, it's not an everyday phone service. So they will call you maybe once or twice a month just to, it's basically for inbound seniors that don't have that social interaction. So they are able to call you once or twice a month, have a conversation, have a chat, but they're not going to check on you daily. I don't know if Jennifer knows of any other services.
I don't, but I would highly recommend reaching out to maybe your area agency on aging, depending on what county you're in and who covers that. They are a phenomenal resource for all things senior, so to speak. If they don't know someone or if they don't have a program, I know that they would be able to help direct you in the direction of, maybe somebody that does offer a program you're looking for.
Maggie, if you're able to put in the chat, ageways.org, that's what Jennifer was referring to. So that should be just a clickable link that brings up a bunch of different resources.